Hey everyone, welcome back. I'm here with Ben, a classmate from Northwestern University. We're both in the counseling program together. We were expecting a few others to join us in this video roundtable, but we'll just kind of go off the cuff and do a more laid back discussion around mental health. Um, we're currently in our last quarter of the program, graduating in December. um, it's been rough. It's been really exhausting. We're currently working on our capstones right now, which again have been exhausting. Ben, what's your capstone going to be on?
I'm looking into the specific purchase behavior and what drives that behavior for young adults in the DC cannabis climate. We just have some crazy rules here, a lot of loopholes that make it so that underage and young adults are able to get illicit substances that are not regulated whatsoever, despite our medical cannabis regulations in
Mhm.
DC. And it's just becoming a huge problem that are impacting kids in the tri-state area. I have a lot of young adults and adolescents who are getting a whole lot of stuff they shouldn't.
Yeah, and right now you're interning at a behavioral health substance use clinic, correct?
Yeah, so it's for mental health intensive and rehab detox. So we have a PHP, partial hospitalization patients for a program for a lot of our more dual diagnosis clients who are dealing with both the mental health aspect and the substance abuse. And then we have our IOP, which is just going to be intensive outpatient, and that's going to be your more individualized mental health situations.
What are the most common secondary diagnoses that you've seen in your at your practice?
Hmm. So, I guess to speak to that, to talk about the most common, and that would be CUD, cannabis use disorder, and generalized anxiety disorder, and major depressive mood disorder. And in those kind of wrap around and feed into the addiction cycle a lot. So we do see a lot with that, the CUD, as I said, and also more impulse behavioral disorders. So that could be opposite defiant, ADHD. We can get a bunch of different all around the spectrum answers there.
Yeah, I'm at a very similar clinic as you're what you're at, and I've noticed that a lot of the substance use clients actually began using as a form of self-medication for their anxiety, depression, ADHD, maybe undiagnosed autism. Um, it seems to be very common. In fact, I was just watching a Facebook Live that a friend of mine is participating in for the Logan Mason rehab. Um, they were doing something on Narcan um,
Mm.
in use of recovery and everything.
Hmm.
And I've had her on here before, did a video with her. She's a recovering addict, and she's got a lot to say on this subject. What are your thoughts on Narcan?
I truthfully believe that everyone should be trained in it. We at my site believe that everyone should, and we all are. We have Narcan in most rooms, just because you really don't know, especially given the environmental and those internal circumstances are going to make someone more or less likely to use even within a substance abuse setting. So for that reason, I would definitely highly speak to it. But there is something to say around, I guess, the lack of information around it and how it can be perceived.
Yeah, my clinic has Narcan pretty much everywhere as well. Um, there's in the bathrooms. There's a lock box on the wall, just full of it. Um,
Yeah.
I'm not really well knowledgeable around substances, and in fact, until I started at my site, I didn't even know what Narcan was.
Mm.
I'm kind of ignorant in that aspect. Even though I kind of grew up around it, it never really it never really took focus. in my life.
Mm,
Like I always just kind of steered clear because my stepfather was an addict. Um, I was raised around it. Most of my mom's friends were addicts and everything, so I
mm,
just kind of steered clear. The hardest substance I've ever used was marijuana.
mm.
So
Yeah.
it's odd since a lot of my friends were in that substance use kind of area
Yeah.
of life and not really knowing anything about it.
Yeah, I think that's what you just spoke to is exactly kind of the reason why the Narcan understanding and that general information is lacking, is just because so many circles try to stigmatize or at least disinvolve themselves from people who are using harder substances. And when Narcan is an opioid antagonist that is helping to reduce the impacts of opioid use, and you aren't someone who is abusing an opioid, you could have very little reason to truly understand it, especially if you're not around people who are actively going through addiction.
Mm.
With that being said, I think that with the opioid epidemic having happened and the impacts that have been since rippling out throughout America, I feel like it should definitely be a little bit more informed in the fact that we have our Xanax users and our over-the-counter uh, just uh, prescriptions that are just feeding this cycle. Of course, there's also the illicit market.
Yeah, the opioid epidemic was really a it really lit the fuse for a lot of people experiencing substance use who never even really thought about getting into substances before in their lives, but then due to injuries or whatever the case may be, surgeries maybe, um, and being prescribed opioids as a way to treat the pain, they became addicted to it. And without fault of their own, they became dependent on it and they were looked down upon by society. I was visiting my grandmother a couple months ago,
Hmm.
and we got talking about um, some of the clientele that we see at my practice and everything, and how we work with those with substance use and everything. And she mentioned um, something like there was no loss if they died or whatever, because that's common belief among older generations is that you can control these things, and that if you become addicted to something, well, shame on you, you're worthless to society anyway, and that's a mindset we need to kind of steer clear of. uh, and I think it's getting better nowadays, now that people are becoming more informed about it, but we do still have a ways to go.
I definitely agree. And I feel that it's pertinent to explain that with that general generation uh kind of giving that perspective of kind of almost laziness, like why don't you have the power to get yourself back into a better shape? It comes from the same understanding of a lack of substance abuse considerations with also a lack of trauma
Mm.
considerations. So I've had several clients now who, unbeknownst to them, had been unconsciously tr self-medicating in order to deal with what was clearly trauma. Um, so examples of that is traumatic night terrors. And those consistent traumatic night terrors that are causing you bad sleep and general and fear nightly can often lead to, like you said, cannabis being used so that it can not allow you to get into that level of REM sleep so that you're not able to dream to that level of severity. Of course, when you stop using, though, the dreams come back with a lot more intensity, and that's where you get your repeat offenders.
Right. And yeah, and one thing I've noticed, um, working primarily with the neurodivergent community,
Hmm.
a lot of undiagnosed autistics and individuals with ADHD will self-medicate as a way of feeling normal,
Hmm.
um, as a way of fitting in with society. With individuals with ADHD, we find that um, substances that um, sorry, this is my autism. It's causing me to like lose track of my words and my train of thought.
No
Um,
problem.
Stimulants was the
Hmm.
word I was looking for. Um, Actually helps to slow down the neurodivergent brain. Um, so, like, I will recommend to my clients who calm down through stimulants, I'll tell them, drink one or two caffeinated beverages a day and see if that helps you,
Yeah.
and a lot of times it will, because those of us who are neurodivergent, we can actually drink an energy drink and then fall right to sleep.
I really feel what you said is like is nailing the nail on the head. But hitting the nail on the head, sorry. But I feel that understanding each individual as an individual along with those genetic factors, and those genetic factors go twofold, whether you're on the spectrum or whether you have those genetic factors coming in from family members with past substance use. You really have to look at the whole picture there, that nature nurture too. So I very much agree. Each individual can be very much impacted by a certain substance very differently than the next. And then on top of that, there's the complexities of neurodivergence and how they can individually be helped by different substances, but that also depends on individuals. So there's no wraparound approach here. But you're definitely right. It's the same reason why I began to bring up Xanax before was for those whose anxiety is to such a level that benzodiazepine is able to bring them to a level of functioning. And it's kind of like the same idea of what you're talking about with trying a stimulant, a caffeinated drink first, instead of jumping to that Xanax to get the anxiety down. In this case, getting that attention under control can start in a very much more regulated plane. And I really like the idea you said of caffeinated drinks or maybe even just some coffee.
Yeah. I myself used to drink, I would probably go through a 2 liter of Mountain Dew a day,
Mm,
which is how I got so heavy. Why now I've got to lose so much weight. Um, I've managed to cut that back to one energy drink in the morning and then a can of Mountain Dew later in the day, uh,
mm,
which has helped because I don't get the caffeine headaches from going through withdrawal and everything.
mm.
Um, I know, speaking with a lot of people who have that addiction to caffeine, they try to stop using and they get those real severe migraines because of the lack of caffeine.
Yeah, withdrawal comes with anything. It really does. With caffeine, it's the same basic science as if you're using more serious substance. If your brain's used to a certain amount of a chemical, in this case, caffeine, it's going to reduce the amount of caffeine receptors in your brain so that it can then on take what the surplus that's coming in. The second you cut back and you don't have that surplus and you've lost those receptors, you're going to be feeling a lot more tired. Same thing with all these other substances and the repercussions of those. So I think that, yeah, that's exactly right.
Yeah. And, going to the doctor's office, and the first thing they say when they see somebody overweight is, how much soda do you drink? You need to drink more water. Well, those of us who have that caffeine addiction, we can't drink more water because we need that caffeine in order to feel normal. You know, it's just like with somebody who's addicted to other substances. You can't just cut it off cold turkey, otherwise, you go through withdrawals.
Exactly, exactly. And as we're learning more and more about withdrawals, I feel like the most pertinent example to this conversation so far would be the understanding of the psychological withdrawals compared to physical when seen in cannabis. We really have to be more aware of that and have that be more of a conversation. So I guess I'm curious how you inform your clients when giving these considerations towards how they can reduce caffeine and in order to make it so that they're not taking a substance. I'm curious how you recommend any sort of regimen, and based on your own experience, how any considerations you have thereon.
I just do a little bit of psychoeducation around their neurology. You know,
Yeah.
since I primarily work with neurodivergent individuals, I'm more um, educated on that aspect than the substance use aspect.
Mm.
So I can help them understand what's going on with their brains. And I'll often promote the use of yoga um,
Mm.
in recovery and stuff like that. So the other person did just show up, so I'm going to add him in real quick.
Sure. Hmm.
All right, Eryk, are you there?
Grabbing some tea. I'll be right back.
All right. So it's really it's difficult going into talking about substance use when you're not well educated in substance use. Like I went through the DARE program and as a kid,
Hmm.
I should be more educated on substance use. I was a police explorer at the local sheriff's department, went through multiple drug training programs and everything, but I never really um, held on to that information because it didn't really impact my life on a personal level. Yeah, I was around people who had substance use addictions. My stepfather had a substance use addiction,
Hmm.
other family members, but the substances didn't really impact me per se. It was just um, the almost like the side quest, the extra that came along with the substances, like the stealing and the abuse and stuff like that, that impacted me. So, all right. So we are being joined now by Eryk. Um, he is part of the autistic community on TikTok. Eryk, do you prefer person first language or identity first language?
I don't care.
Okay.
I'm kind of fine either way. It doesn't really I think part of it is because I was late diagnosed. I was diagnosed at age 39 and I'm 44 now. And so for me, I think because it was such a huge answer to so many things I was dealing with, that whether it's person first or diagnosis first is not really a thing for me, but I definitely want to respect anyone else's preferences.
Right. And that's why I generally ask which um, way people identify, because so many people have different perspectives on it. Um, During my research for my capstone paper, I found that professionals prefer identity first, while those in the community prefer person first. So I'm always aware of that there are different preferences. I myself was diagnosed at 41. I'm 42 now, about to turn 43 next year. And I lean more towards the person first language because it's such a huge part of who we are. You can't really take it away from the person. It's not like a piece of luggage you're carrying around, it's who we are.
Yes.
So I see you have Hugh there with you today.
Yes. Yes, I do. Heart. Hang on.
Hugh is his skull that he painted silver, named after Hugh Jackman because of the
Deadpool. Yep.
Logan character.
Yes. So Deadpool has been, along with Spider-Man, have been two of my favorite comic book characters for a very long time. And when the movies came out, I was beyond ecstatic. And thankfully, my wife is very supportive because the first Deadpool film came out on Valentine's Day. So that was our Valentine's Day date. Because she was like, I'm pretty sure we're gonna go see this, right? And I was like, yes, please. Anyway, so when Deadpool Wolverine came out, like the whole family went because we now have three children.
Mhm.
And all of my kids were like, they knew how excited I was going to be. And so the whole family went. And when I saw the silver skeleton, I was like, I need, in fact, that's been my big beg this year is like I told my wife, like, I need a silver skeleton bit. Like I need the whole thing. Like I have a skull, that's great. I collect skulls. I have several here. I've got some
Two.
in my office at work. Yes.
In fact, I did something similar to Hugh last year, only mine's gold with silver teeth.
Oh, I love it. Yes. Oh my goodness. Yes. I really wish I had done that with the teeth for because this is Midas.
Nice.
Yes, I needed to. I kind of didn't give you the same details where the eye holes were still dark, and he just ended up all gold because I was lazy. But yes, oh, I love it. I'm so glad I'm not the only person.
Yeah, I
Well,
have
who's missing out
skulls
here?
all over my office.
Yes. It's always so hard to explain to people because they're just like, so it just seems so grisly. And it's like, no, it's really not. And I think part of my perspective, I mean, I have like it's not even melodrama. I did almost literally die once. So, and it wasn't quite the drama I thought it would be. So it was kind of like it was low key traumatic, but then like on the other side of it, it kind of just went along with my dark sense of humor. And I have a chronic illness, so making light of things is kind of my coping skill. And so I just crack like a really bad joke and be like, well, I'm just getting used to them because I'm gonna be one soon. And then they're just like, oh, and I'm just like, no, it's okay. It's okay. It's just statistics. It's just anyway.
I was goth growing up, so that's where my love of the
Yes.
macabre comes in. You have a TikTok account that you've been uploading onto pretty frequently. You talk a lot about your elf ears on there, which I noticed you're not wearing today. Um,
No, not at the moment. Sometimes I have to glamour as human. I just had to go pick up my son from work.
okay. You're also one of the few um, Black autistic creators um, on the platform. Tell me about your experience being autistic while also being a BIPOC person.
That is wow. Okay, so it's pre-diagnosis, it was difficult because I didn't know why, because all of those things you normally pick up on, right? As a neurotypical person, when you're growing up, you naturally pick up the accents and traits and social cues and all these things that your community has. And when you're autistic, you don't learn that way, not normally. Like you might learn to mask that way, but it doesn't actually become part of your personality. Whereas for most neurotypical people, it does become part of their personality because it's just, oh, well, this is what people do. All right, then that's what we're going to do. And that's who I am. And as an autistic person, I just note, okay, that's what they're doing, but that doesn't make any sense, but I'll do it to fit in. But then I'll be like, hey, what if we do this? And then, we get laughed at. So within the Black community, especially, things aren't written down, right? It's very rich culturally, but unlike, like most other communities, like if I wanted to learn about mannerisms or how to dress, there are so many books written from European cultures and from a European perspective on what to wear and why we wear this and how to, tie a tie and put on a suit and blah, 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 and what to wear when. All of that is cataloged, right, in books. Whereas in the Black community, it's really meant to be absorbed through observation and immersion within that culture. So I found myself extremely isolated because I just pulled from any culture I thought was interesting as far as what I would wear, how I'd behave was interesting to me. And anyway, so it got me so that was a big part of growing up was that isolation because I hate to put it this way, but I wasn't Black enough, right? My musical interests weren't aligned fully. My standard of dress, I mean, like even now, like I wear kilts, in fact,
I was going to mention that.
the last recent online brouhaha around me was me wearing a kilt, and everybody was, thought, oh, he's wearing a skirt because you don't normally see Black men wearing kilts. And that came about because my whole life I'm trying to be comfortable. Clothing is very uncomfortable. Honest, is just a whole thing for me. And I started wearing kilts about 10 years ago. and it was great. It was like it solved all my problems except for it increased my social problems because it got me attention. And for a long time, my clothing was kind of scientifically designed for me to be ignored. Especially like what I wear to work. I put a lot of study into this and research. That's one of my special interests, is just the act of researching. And so I learned how to create and craft outfits that was just enough so I would be ignored. And learning to honor my sensory issues meant that I stood out even more. And that, as I don't know if you've followed any of those videos where I was wearing the green kilt, and some of the comments that I got in there were extremely negative. But what I am discovering is that what I discovered through pushing through that whole situation is that there are actually a large number of Black autistic people out there. They just haven't felt like they could say anything. And so big roundabout way to answer your question. My experience of being an autistic person of color is that being Black is already being marginalized in its own way. And being autistic is already being marginalized in its own way. And when you that overlap, it's like you're marginalized within a marginalized community. So it's hard to autistic behavior can look different on a Black person. So like for example, me having a meltdown in public is a absolute no-go. Because I'm not young anymore, right? I'm not young, I'm not white, and I'm not small. I'm 240 pounds. So me, squealing and flapping my hands in the middle of a grocery store is not going to cause a bunch of people to say, "Oh, poor baby, how can we help you?" They're going to be like, "Oh no, he's going to attack somebody." I mean, that is the fear.
Yeah.
So that is part of the experience, and then the other part of the experience is not not everyone within the Black community sees me or even will acknowledge the autism. They'll just go straight for anything that doesn't fit within what they believe people within the culture should be doing.
Yeah.
But again, like I said, I know I'm not the only one, and so I've been very persistent in being authentically myself as much as I can, because I also do get emails and DMs from Black neurodiverse people saying, "Thank you so much for being out here and for showing yourself this way. I feel a lot less alone. I've also felt isolated." I've had some people send me very encouraging DMs saying, "Hey, it's not the whole Black community that's not with you. It's just the loudest people in the room that do get the most attention, unfortunately, within any community, right? It's not just within the Black community." And so what I've discovered is that really what I perceived as the majority being against me was really a minority of people refusing to support me. And in reality, the majority of the Black community does actually support me. It's just, and it's probably similar to other, like I said, other experiences where it's just the meanest and loudest people somehow tend to get the most attention. And unfortunately, the most cutting feedback tends to be what sticks in our heads.
And in the autistic community on TikTok and YouTube, we hear a lot about the double empathy problem from Milton, 2018, where neurotypicals can't really understand neurodivergence and vice versa. Um, but while I was preparing for my capstone, I came across a study that presented a triple empathy problem that had to do with neurotypicals and autistics and the healthcare industry or
Mm.
healthcare community. Um, and really, that triple empathy problem can um, kind of encompass just about anybody. It doesn't have to be the healthcare industry. It could be neurotypicals and neurodivergence and people of color, or neurotypicals, neurodivergence, and women, or non-binary individuals. It doesn't have to
Mhm.
be um, exclusive to the healthcare community. And then you have the quadruple empathy problem, which encompasses all of that, where if there's a female who may be BIPOC, who may be autistic, you know, so these empathy problems can really encompass multiple layers. It's not just a double empathy problem or a triple empathy problem.
Yep, absolutely. I think that, and I think that part of it is that so much of is, I think from education, because that's my background, so much of education was about finding a scientific, simple way to educate everybody the same way. And that system gets messed up when you start having to make room for other cultures and other experiences and different genders and different religions. And I think that out of that frustration almost comes this like refusal to acknowledge or empathize with a student's uniqueness, which then turns into a refusal to empathize with that uniqueness as an adult when you get out into the world. And in the workplace, an employer doesn't want to accommodate someone who might have different cultural needs or a chronic illness or different neuro whatever needs words. um because it's difficult and it does take time to make space for people. And I think that a lot of the pushback that we've seen in the public discourse has been this, like, why can't we just go back to the old days where we hid all the people that were different and we just had this one way and you either fit in or you didn't, because it's easy. And unfortunately, it is, but it's not how we get the most out of the people within our communities.
I want to give Ben the opportunity to kind of chime in on this, maybe ask any questions that might come to us. I know you and I have kind of been bogarting the conversation a little bit, so
Sorry about that.
that's fun.
Yeah, no problem at all. I really enjoyed listening to that. And I feel that you're speaking to exactly how I feel in my sector of understanding, and that would be substance use. And I feel that the generalized approach, that like the idea of the wraparound standard, it isn't there. And to look at an adolescent and give that, I guess, like you're saying, those levels of empathy and looking at a trauma-informed approach, or maybe even looking at specific events that might have recently happened that wouldn't be considered traumatic, but are definitely impactful. It's almost disregarded as they grow. And that initial trauma, that initial event that led to the substance use might not have been dealt with, or it might never have ended. And given
Yeah.
all of that, the idea of, yeah, this wraparound, you're not an individual. Let's put you in a box where we can just categorize you and just throw this blanket um treatment over you is very dehumanizing. And on top of dehumanizing, it's not good practice. It's not empirical, it's not good science.
It makes me think of when I would go to parties when I was in my early 20s. And if I was, buzzed or just flat out drunk, my sensory issues weren't as strong. And I could actually enjoy people's company. And I think that, a lot of times, like you said, that trauma informed aspect as well. Like, we're not asking the questions of why is the substance abuse happening? What are we missing here? And instead, we're just attacking, oh, so and so just needs to go into rehab because they just have a problem and they're just, messed up. And it's like you said,
It
it's
goes
not
back
always that
to
simple.
kind of goes back to what Ben and I were talking about before you came on about self-medicating as a
Hmm.
way to feel normal for the neurodivergent community. Um, by the way, since you missed the introduction, Ben and I are both Northwestern students in our final quarter, about ready for graduation in December. Um, Ben works in substance use as an intern currently. I also work in behavioral health as an intern, but I specialize in the neurodivergent community as an autistic individual myself. I wanted that to be my focus. So,
So very nice. I am currently pursuing clinical mental health counseling because teaching, I do have an undergrad and a master's in education, but due to I have lupus, and it's progressed to a point where I can't physically lead a classroom anymore, at least not in K through 12 education. So I've been figuring out what my next steps will be, and so that's kind of what I'm pursuing. So similar, so mental health is definitely something that's very important to me, and I definitely hope to also approach it from a neurodiverse lens because we really do need more neurodiverse people in mental and, well, in healthcare spaces because yeah, it's hard when you don't have that inside perspective. And I'm sure you've met people that have just studied, the neurodiverse community, and they're just like, oh yes, I know this, and and it's just like, eh,
That,
no.
and you also have clinicians who don't know anything about the neurodiverse community. They're just kind of going based off of what they were taught, which was very little. I can count on one hand how many textbook pages I've read from undergrad to grad school that involved autism or ADHD, and that's
Mm,
including um, special education classes, which I
wow.
took during my associates. And it's just and the information is so far behind because
Mhm.
textbooks, they don't get updated yearly like
True.
research is. So they're still operating on early DSM-5 understanding rather than where the DSM-5 is now and where our clinical understanding is now.
So Ben, I was wondering, since your focus has been on substance abuse, and just 'cause last night our family watched the movie Thunderbolts. I don't know if you guys have seen it yet.
Watched that last night also.
Okay.
Haven't gotten to it, but it's coming.
So it is the best. It's one of the best superhero movies I've seen in a long time. And I loved the focus on mental health. The movie focuses
Mm,
so much on mental health. And the main character, they don't use the term bipolar, but they're pretty much describing that. And that character did have a history of substance abuse. And so you kind of referenced that. And I kind of was wondering if you talk a little bit more about that overlap of neurodiversity with substance use and how that self-medication might be used as an attempt to, or even with trauma, as an attempt to find their own way forward.
definitely. And I'm really glad you brought that up, especially just after you had just spoken to that general idea of just the different dimensions of care not being able to conversate and overlap and understanding there. And I feel that since we it hasn't been spoken about yet, I have been a teacher. Shannon, you have teaching experience, and Eryk, I'm just finding that you as well. So it it really makes sense looking through that perspective to begin and looking at the amount of, I guess, almost counselor responsibilities that teachers are given and to look after their kids. And it's kind of the idea that the parents see school as an all-encompassing area where you can just get help from a lot of different people with experience, and they're going to help you with the different dimensions of your life. And I feel that when turning that over to substance use and substance abuse treatment, you're getting kind of the same idea. It's kind of the idea of we can become social and behavioral experts at times, or if not, we have to put on those shoes because we're expected to, even though when the actual issue here is not behavioral, but it's substance based, but we have to speak to the behavioral first. And we have other examples where, um, specifically with neurodivergent people, as Shan was saying, there is a great unifying effect behind substances that I don't think is spoken to, and I think there's just a giant stigma attached to it and why it's not there. Specifically around your more common things like marijuana and alcohol, you can get rid of a lot of social inhibitions. And if not that, you're leveling the playing field. A bunch of people who have recently smoked cannabis are going to be all a lot goofier, and the general environment is going to be a lot more accepting. Alcohol with its getting rid of your inhibitions. I feel like these all coordinate with an idea of just again, expecting more of different administrations and different programs, and also just not thinking about people as individuals.
Mm.
From my experience growing up around substance use, having friends who were addicted and everything, I found that I didn't really need to be high. And when they were high and I was hanging around them, we were more on level playing ground, right?
Hmm.
Because I didn't feel the need to mask as hard, um, because they were more like me now rather than
Hmm.
me trying to be more like them.
Yes, yes. Or even just that the behavior was, even if they weren't acting like me, if they were high or if they were drunk, then I could be more unmasked because everybody was allowed to be left of normal. No one was expected to live within the bell curve of normal because of that. That, and I think that and again, that we forget or we miss that when we're looking at, people who have, alcohol or other substance abuse dependencies. We're not asking, is this how they're just coping with the world because they cannot access, counseling or proper care or the lack of acceptance within their own communities for who they are? It could just be them trying to just get through the world. Hang on a second. I'll be right back.
No problem. So I have a quick question, Shannon. I'm wondering, before Eric's came in, we initially talked about just the stimulant use by neurodivergent individuals, just try to get that level of focus. Um, Recently, I just had a long conversation with my clients about the mix of uppers and downers and how that can play on the body, especially mixing a downer like alcohol, and there's drinks where the mixer is a stimulant, and there's drinks, and there's also the idea that you can be stimulating yourself before going out. I'm curious how that interaction can be discussed in a neurodivergent confirming way.
Not sure on the research on how alcohol affects the neurodivergent brain, but I would imagine from my own personal experience that with alcohol being a downer, um, it almost raises us autistics up a little bit.
Hmm.
And then with substances, stimulants being uppers, brings us down a little bit. So, like with alcohol or marijuana, um, we can we begin if you're simply just autistic, you can focus on everything a little bit more. You're not so bottom up processing; you're more in the middle.
Hmm.
Um, and then you have others who are both autistic and ADHD, and so they're doing both the bottom up and top down processing at the same time, and that's what causes that um, inability to pay attention, that lack of focus, because they're aware of everything. They're processing everything and the smallest things all at the same time. um, I don't know. I would like to look into that to see if there's any research on the impact on the neurodivergent brain when it comes to downers.
Yeah, that would just be very interesting. Especially with just how we're speaking about downers and uppers. I was curious if how to consider a situation like that where uppers and downers are in play. I feel like that's one of the most pertinent examples of modern mixing of drugs. That's a lot common night for a lot of people. So thank you for that perspective. I'd be interested in looking up at that too.
Do you have any experience in that with how downers impact you?
So yeah, so for me, so I'm autistic and I have ADHD, and so downers like like an alcohol type thing, it it slows me down a little bit. And that actually becomes a calming thing because I'm not processing everything, and that part of my brain that's like trying to, all the data that's coming in that my brain's trying to handle and deal with, and usually does, but it kind of starts saying, yeah, we can just kind of ignore some of this. And it kind of lets some of it slide. So I'm not as aware. So my hyper awareness comes down, which then I can relax. So it ends up having an energizing effect because it's like if you were running and you were pulling a sled that had like 50 pounds on it, and then weight starts coming off that sled, you start running faster. And that's the effect that it would have for me, is that
Mm.
because I'm relaxed, I'm not filtering everything I'm saying. I'm not worrying about whether or not I'm tracking all of your facial cues. I'm okay not getting the joke. It's all these things that I stress about and I worry over all the time. My brain starts just kind of pegging as, that's irrelevant. That's irrelevant. That's irrelevant. Let's just do what we feel like doing. And so that's when I end up having fun because now I'm just enjoying myself instead of worrying about everybody in the room and all the faces and conversations and trying to track two to three conversations at once. I'm just talking to the person in front of me, and that's all I'm really worried about. And so I end up appearing more social and more relaxed and a little and funny because now I'm just saying the thing that popped in my head. You know, wow, have you ever noticed that Jim looks like a giraffe when he dances? Just things that I probably wouldn't say,
Mm.
in day-to-day life. Yeah, so I think that if it if the substance solves a problem, I really see that's where that dependence can come in. Because like I said, it's fixing, right? A problem, whether it's concentration, whether it's focus, whether it's just the ability to relax in that environment. It made me think of the rise of cocaine use in the 90s. It was also the rise of what I would call the extrovert. You look at, the 50s and 60s, post World War II, more people are being born, more people are existing, and more books are being read and thrown about, like How to Win Friends and Influence People. A lot of those texts, some of them weren't necessarily written during that time, but when you look at self-help texts written in the late 1800s, early 1900s, it was more mindfulness approach. And I can't, what was that guy's name? Dang it. It was this book called How to Live on 24 Hours a Day. The author was hella racist, but had some really great points. So it's like those books, you ever book like you read it, but you would never recommend it because half the things the author says is awful.
Yeah.
This was this guy. He was very misogynistic, very racist, but when he was just talking about productivity and mindfulness, it was actually rather helpful. The minute he started talking about other people, it all fell apart. And I was like, dude, just shut up, stay in your lane. But anyway,
Mm.
um, so I can't ever recommend the book because there's so many awful things in there, but there were some things that he said that I did find useful. But then you look at books written later and like Dale Carnegie's there's somebody else. Dang it. Whatever. Anyway, that era, it was all about people and connecting with people and being this, extrovert and the extroverted businessman. And my personal theory was the reason why so many people were doing these drugs was this need to constantly be cheerful and upbeat and connecting with people. And um, I don't know. It's just my theory.
Yeah, your comments on the people who write things that they're very insightful, but you wouldn't really recommend them. I was kind of reminded of Simon Baron Cohen in that aspect.
Mm,
He is the biggest name in autism research, and he has helped the autism research progress, but I feel like he's still stuck in that early mindset. His whole thing was extreme male brain and refrigerator parenting as the cause of autism, and that girls can't be autistic and everything. But some of his research has helped progress the community as a whole. So, while yeah, I don't really recommend listening, hanging on to every word he says, there are some benefits to reading his work.
Hmm.
I'm
Gotcha.
interested how um, hangovers impacted you as a neurodivergent, because I know during my teens and 20s, I wouldn't really get hangovers after a night of binge drinking. I would actually be hyper the next morning. I would get up and start cleaning up the mess I made. Um, the place was a disaster area. I'd get it all cleaned up before everybody else woke up, but I drank more than everybody else. How did hangovers impact you?
It's hilarious that you said that because that was very similar to my experience as well. The only thing I noticed was that I felt dehydrated. And so after the first time that happened, I would always bring a bottle of Gatorade with me in case I stayed the night where I was. And I would get up and I would start cleaning because that was like my next move was I liked tidy spaces. So that's where like, the autistic side of my brain that wants order and so even if it wasn't my home, I would just be like, oh, this is not going to work. And I would wake up before everybody else. I'd wake up, I'd drink my bottle of Gatorade, I'd go back to sleep, I'd wake up a little bit later and I would feel like I'd feel great. There wasn't ever a problem. The only time I experienced a hangover was it was like a 3 day party situation. And on the third day, I did feel like garbage. But for the most part, I didn't really have that problem so long as I followed the protocol of having a Gatorade or electrolytes to drink either in the middle of the night or when I first woke up in the morning. So, yeah.
So that kind of lends credit to the idea that downers for everybody else could actually bring autistics more up to level, um, and then stimulants bringing ADHDers down to normal. It's really fascinating how that interacts with the neurodivergent brain and our chemical makeup.
Yeah.
Yeah.
It's really interesting. And I wish that there was a safe way because I would never want, because I don't want to like, anyone to come to harm, but it does make you wonder, you know, is there a healthy way? Like for me, at this right now, my other health issues, alcohol is very much a no-go. I hardly drink at all now. Not out of any sort of like clean living thing. It's just my heart medications and stuff do not interact well. So if I do have alcohol, it's like I have to plan. It's like a planning thing, and I have to reorder when I take my medications, and it's like more trouble than it's worth.
Mm.
But it does, make you wonder. I guess I wish there was a way to at least, even if it was just an interview-based study on how they felt when they were on on the different substances to help. I feel like to help the healthcare community understand what is the problem that is being solved by it. And again, like we were talking earlier, instead of the immediate judgment, I think there needs to be more of this person is obviously trying to solve a problem. This may not be the healthiest way to solve the problem, but it's not just, I'm here trying to ruin my life. They might be trying to fix their life or, and you know what I'm saying? Like, and especially with not everybody being able to afford, access to mental health resources, whether it's counseling, or what have you, sometimes self-medication can feel like the only route.
And the mental health and medical communities aren't really known for their understanding of the neurodivergent brains, right? So if you're
Mhm.
undiagnosed autistic or ADHD, they're going to try so much other stuff before they decide to test for that, which is why so many of us go so long without a diagnosis.
Yeah.
We get labeled with generalized anxiety disorder and depression primarily. Those of us who experience childhood trauma get labeled with bipolar or borderline personality disorder or any number of PTSD, any number of other diagnoses before anyone will even consider an autism diagnosis, especially if you're a person of color or a female.
Yes. No, that's absolutely true. In fact, I know somebody who she went for um testing and they were just like, no, it couldn't be that. When I'm almost guarantee if she was a man, they would have been like, oh no, absolutely, this is it. And and from what I understand, at least from what I've observed in the classroom as an educator, girls are more likely to, well, in general, girls tend to show more advanced social skills than boys, and so they're more likely to be better at masking. They're going to be a lot better at, not acting out in the classroom. Their anxiety, their hyperactivity is going to show up differently. My daughter, for example, she is, her ADHD doesn't show up as, physically, moving around or jumping around. It's definitely not in the classroom. In the classroom, she's trying to sit still and actually,
Yeah.
and do what she's supposed to do. Her grades are decent, but it shows up when she comes home. It shows up in exhaustion. It shows up in, anxiety. And so if I didn't know to look for those things, I don't think that, because her teachers never said anything to the effect that, she might have it. Same thing with my boys. Their ADHD doesn't show up in the classroom for the most part. There might be some behavioral issues, but some of it just also gets kind of chalked up to them being boys. But, well, and of course, and being boys of color, they're less likely, again, it's more likely to be assumed that, oh, it's a behavioral thing. It's not it's not a can't do. It's probably a won't do, because that's what it was like for me when I was growing up. And, thankfully for us knowing what to look for as parents, we were able to, advocate for, getting some evaluations done. But yeah, it's definitely it's harder when it's not being caught and they don't know that's what they're supposed to be looking for. Or they go for like the easy things, like anxiety is an easy diagnosis to, just to give versus the effort it takes to, work on an ADHD or an autism diagnosis. I only got mine because it happened during COVID and all the schools were shut down and there weren't any referrals going in at the time. So I kind of was able to quickly get an evaluation. I don't know how easy it would be right now with everything open.
I had to go to Illinois State University to get my diagnosis, um, because there aren't any places around here that do adult diagnosis or assessments. But the psychiatric department at Illinois State University was offering discounted autism assessments. I think mine was like 1,500, and they can get anywhere up to like almost $7,000 for a diagnosis. And so I went in there and they broke it in half. They allowed me to make two payments, which was really awesome because who can afford to throw down $1,500 all at once
Yep.
nowadays?
Yep.
And it was a whole day thing. Went in for the assessment. They had two people in there for the assessment. I brought in a big packet of my own observations plus previous psychological assessments, specifically from when I was in school and everything. They use that as background information because, I'm no contact with my family. So I didn't have that extra people to bring in that knew me in childhood so that they could rely on the previous psychological assessment from when I was in fifth grade to use as my background information. And I was able to receive my diagnosis. but a lot of people don't have that ability because of a lack of professionals who are able to diagnose adults.
Yeah, well, and I think that, and also, like you said, and also having other people to kind of vouch for you, if you will, or to speak to your experience. So for me, it was my wife. She was a teaching assistant, and she was actually the first one that identified it. She was a teaching assistant, and she would talk about the autistic children in the classroom, and she would say, this child was really upset because like there was a guest visiting the classroom and no one knew about it. And I was just like, why would you have a guest in there and not tell anyone? Why would you change your routine and not tell them? That's horrible. And so she kind of started noticing that. And then, and so then when I started therapy, she met with, there was one session where it was the three of us. And so she shared that. And so the therapist actually was the one who ended up recommending the I get tested, because we tried to talk with my primary care at first, and my primary care was like, no, I don't really think that's necessary. I don't think that you need it. And so, but because, I was able to have some therapy sessions, and the therapist, you know from hearing, someone else's kind of corroborating my story. I hate to put it that way, but that's kind of what it felt like. It felt like kind of being on trial and having a witness. And then so with between my wife's observations and the therapist's observations, that really what kind of got me into that referral to get the testing. Um,
Do you
so
think if you would have walked in there with the elf ears and the kilt, it would have made it easier to get the diagnosis?
Probably, probably. I think that if I went in now, where I'm a lot more comfortable unmasking, it would have been a much simpler conversation. But I was still fairly high masking at the time because I mean, it was kind of slipping because of COVID. I was home a lot more. And at the time, we were renting a house that sat on a couple acres. So I had a lot of space to just be myself. And so so it was kind of becoming a little bit easier. But yeah, I think that if I had walked in, and jabbered on about whatever, I think that it would have been a lot smoother. And I was going to ask you, Shannon, about since you were also late diagnosed, what was that experience like for you going in for testing? Did you have to consciously unmask? How did you feel going through that?
Yeah, I did have to consciously unmask. Um, I remember feeling the need to mask and wanting to mask, but then remembering that I couldn't do that and be accurately assessed. And so I'm not sure if that made my autistic traits more present. Maybe I brought them out more. Um, I when they brought the toys out and put them on the table and um, said that we were going to take a break and that I was welcome to play with the toys if I wanted. I remember looking at them and kind of fidgeting with them a little bit. There was a little Hot Wheels car and a couple of things. I picked them up, just kind of looked at them and then set them back down. The unmasked autistic in me would have probably rolled the car around a lot more, would have probably fidgeted with the toys a lot more. If they would have had like a transformer in there, oh, I would have definitely been messing with the transformer and transforming it and untransforming it and everything else. Um, the toys they had were very simplistic, though. Uh, so they seemed more like fidgets than anything else.
Hmm.
And I had that um, voice in my head. You're an adult, you don't play with toys. Parents used to say that to me when I was younger. Other kids my age would say, aren't you too old to be playing with toys? So I consciously had to make the decision to stop playing with toys. I was 15 whenever I stopped playing with action figures because we moved from a farm where I could get away with that because we were in the middle of nowhere, didn't really have any company my age coming over. Um, so I could get away with playing with my action figures. Then we moved into a trailer park, um, more individuals my age, knowing that I had to actively put down the toys, um, force myself to stop playing with them because I was tormented already at my previous school, um, bullied severely, given concussions, a broken collarbone, stuff like that because of how severely I was bullied. I was worried about having that bullying and that trauma follow me to this new school. So there were a lot of things that I did, like I actively sought out um, the goth subculture in order to overcompensate for that. And while, yes, it made me feel more like myself, it was also a way of pushing people away, of making them afraid of me so that they didn't approach me and discover, those unusual traits about me that other people would see as immature or whatever. Um, so yeah, that was my experience.
Okay. That's that's similar to mine. When I went to get tested, I kind of had like a little pep talk with myself in the car. It was like, you can't, don't say anything you think they want to hear. Be honest, and this otherwise they're not going to be able to notice anything. And it was like taking off a heavy coat that I've been wearing for so long. I didn't know what it was like not to wear it. And I remember like the first thing they asked was, like, how are you? And I kind of actually thought about it. Instead of giving my scripted answers, I was like, what is the, and I was like, I don't know. Because that's really the true answer is that I have very strong emotions, but there are also large blocks of time where like I'm just neutral. I'm not positive or negative. I don't know how I feel. And, it was like, what do you think this person's expression is? And I was, and the truth was, I don't know. I don't know the person long enough. I haven't had a chance to map out the patterns. I don't, if I'm not, if I turn off that hyper focus, if I turn off, all of that, it's like, I don't know what that person's thinking. And yes, I will gladly play with this. And no, I have no idea what you're asking me to do. And I'm not going to overclock my brain when normally that's what I would do. It overclock my brain to try to figure out, you know, how can I figure out what this person wants? What can I, extrapolate from what they're wearing and how can I pull this together, you know, and instead just be like, I don't know. And it was, and so I ended up being so much more relaxed in that testing session because I was just like, I don't have to get anything right. Nothing is hinging on this. They're not gonna physically hurt me, and I'm not gonna lose my job over not performing. And so I just dropped the act. And but then I got in the car and just bawled because I don't think I'd ever realized how hard I work to exist.
Right.
So yeah.
Yeah. We spend our lives being forced to mask. I remember I was in chorus all through school mostly. Sorry, my kid came in and wanted to grab something, so I had to stop. Um, I was in chorus all through school, and I remember performing in concerts, being told, "Okay, stand up straight, don't move, don't fidget, don't. If you got an itch, ignore it. Look straight." And all this, and the entire time I was just very overstimulated. As you know, probably noticed during this, I've been tugging at my shirt, um, and everything. And that's me unmasking, you know, having to deal with that growing up out of fear of being scolded for fidgeting or whatever. Um, and now understanding my sensory needs, um, it's releasing. It's really, it feels like a weight coming off, you know. Um, I can't stand things close to my neck, which is most of my t-shirts are, stretched out at the collar. Um, Seeing you with that necklace on is like, I've tried that.
Yeah.
I forced myself to wear necklaces like that when I was in high school because that is the 90s. That's what most guys our age were doing to fit in.
Yeah.
It was very overstimulating for me. Um,
Mm.
Now I try to wear a necklace and I have to add an extension to it because if it's too close to my neck, it's going to drive me nuts. And then I end up wearing these really long necklaces that, while, yeah, they still look good, it's not really the quote unquote norm because it's not like close at, as what people usually wear. Um,
Mm. That
and
makes
you,
sense. Sometimes so for me, the necklace is actually solving a different sensory problem. So one, if it's just the shirt collar, I do understand. It's not one of my deal breakers. Pants are really my deal breakers, but it does bother me. But if I have a necklace on, then it's not as noticeable. I do wear ties, and I've had several jobs where I had to wear a tie. And so I almost kind of I had to get desensitized to it, if that makes sense. Um, so like there's like a professional mindset where I put up with sensory things that I would not put up with if I'm not working. But I have a I forget the medical term for it, but there's something on my thyroid that's growing. It's not cancerous yet. It's kind of in the we need to check on it once a year to make sure it doesn't become that.
I was in
And
that same boat and I had a partial thyroidectomy.
okay, so mine's not it's not serious enough yet, and I only know about it because I kept complaining about. I was like, I feel like there's something pressing on my neck. It's just this constant feeling of like as if someone's just standing there gently pushing on your throat. Not enough to cut your wind air off or anything, but it's noticeable. And so when I wear a necklace, that gentle pressure of the necklace kind of tricks my brain into thinking, oh, it's just a necklace, you're fine. And it doesn't drive me crazy as much as if I'm dealing with inflammation and it gets more noticeable
Mhm.
and it just drives me nuts. And it's hard, like when I first had the ultrasound and the doctor's just like, well, it's nothing serious, and I'm just like, yes, but I can feel it. It's like, well, it's barely there. And I'm just like, okay, yes, I'm autistic. I have sensory issues. I notice things that you're not noticing. Like, I'm sure you haven't noticed the fact that that machine has been making a sound the entire time. Can you hear it? The guy's like, no. It's like, it's making a sound. I can hear that sound. It's driving me insane. And I'm having a hard time listening, and that's what we were talking about earlier about when the medical community is not well versed in neurodivergence, whether we're talking about a doctor's visit or substance abuse counseling, if you're not taking into account the sensory needs of that person, then you're going to misunderstand so much of their motivations and what's going on with them. And I need to sign off in a little bit, just
Okay.
FYI.
Me too. Dinner's been ready for about half an hour. So, uh, something I wanted to ask you about real quick before we get off here. You do a lot of videos on TikTok with your own version of Beautiful Day in the Neighborhood. And I thought that was so awesome because I've been bringing Mr. Rogers into my therapy practice and using Mr. Rogers to help um, with anger problems. What do you do with the mad that you feel? And um, I truly think Mr. Rogers might have been autistic. If you ever watch him, his slow, thoughtful speech
Hmm.
is very reminiscent of an autistic person who's trying to find the
Oh,
right words to say.
It would make a lot of sense. I mean, I could see where even when you think about things like his show, how everything was very formulaic. The way he came in, obviously the songs were the same. His movements were almost, so well rehearsed. It was like choreography, the shoe toss and everything. And that, I mean, if an autistic person were to make a show, it would have those repetitive elements to them that, that really solid structure. Whereas, like, you think of something like Pee Wee Herman's Playhouse is a very excellent example of ADHD on steroids. You know,
100%.
um, I wouldn't be surprised. I wouldn't be surprised if that were the case. If Fred Rogers was autistic, I could see that being, especially in his gentle subversions of social norms.
Mhm.
If I think about the episode with the black police officer and them, like, having their feet in the
Mhm.
pool, and this was at a time when one of the controversial issues was people of color not being allowed at public pools. And so I could see someone like a Fred Rogers being like, I don't logically see why that's a problem, and then it's been like, I'm going to do that. So yeah, that's a really good observation. I like that.
Yeah, and I find myself, now that I'm getting closer to graduating and being a licensed counselor, going back and rewatching those old Mr. Rogers' Neighborhood episodes, because he can teach a lot to the clinical community about how to talk to a person, how to relate and connect to a person. In my child and adolescent counseling class this past quarter, I brought Fred Rogers up quite a bit in the asynchronous work. I'm sure the professor got tired of how much I talked about Fred Rogers, and even had us, when we had a substitute, had us watching a scene from Mr. Rogers' Neighborhood where he talks about grief and how when his dog died.
Mm,
Um, I think they need to add that to the curriculum for all counselors and anybody in the mental health and healthcare industry, of watching episodes of Mr. Rogers' Neighborhood on a regular basis throughout the class or throughout the program, just to stay connected and learn how to connect with others, whether they be neurotypical or neurodivergent.
absolutely. And completely off topic, but I got really excited when you said that you guys are studying at Northwestern, because when I was a little kid, we lived in Chicago, and so sometimes on the weekends we would go to that campus. Like, I remember, like, bike riding around that campus, and anyway, so that was just like this. I remember seeing going to see the fireworks there one year, which I hated. Um, but anyway, so that was just like really kind of like a cool little, like, connection there, and it was like, you ever like have somebody say something and your brain gets so excited, and then it's just like, whoa, hang on, you don't know these people, you need to just give it a second. And so that was like a masking moment for me. Whereas, like, my instinct would have been to probably let out a shriek, which I don't know your sensory issues, so I try not to do that if I don't know the person very well, because I've been told it's quite awful. Um, but it was very exciting, but then it was like it kind of hit that wall of, wait a minute, we don't know if this is acceptable behavior yet. You need to just calm down and don't say anything yet, because you don't know how to say it without losing your mind. Anyway.
Well, that's kind of like, I'm sure Ben has noticed, anytime neurodivergence gets brought up in any of our classes, I'm always the first to raise my hand and talk about it. And I've probably burnt so many people out on me talking about neurodivergence and
Yeah.
being like, okay, here's what you should do in this case, and maybe try this approach and all this. And it's hard not to get excited about something like that, especially when it does become your special interest. Since
Yeah.
before I even got my diagnosis, I was kind of attracted to neurodiversity. Um, I could spot an autistic individual with knowing very little about them, um, in whether it be in school, in undergrad, or whatever. Just speaking to them one time, or even not even speaking to them, but sitting in the same class or in the same room with them and observing them, I could just easily spot it. And looking back at many of my family members, I'm retrospectively seeing that neurodivergence throughout my family.
Yeah.
And now having that self awareness and having that as my special interest now, anytime the topic of autism or neurodivergence in general comes up, I'm generally the first person to just info dump about it. So,
I
so
know I feel the same way when it comes to substance use and cannabis, so I don't know how our classmates think of us, but no, I definitely think it's informative and it's interesting how each of us have our own niche within a niche, and I think that's what makes these conversations more insightful.
Absolutely. It's how we learn from each other.
right. And that was the whole purpose behind me doing this series for YouTube. Um, is to bring not only awareness but understanding. I've been interviewing different people. I interviewed um, a few people with schizophrenia, substance use disorder, other autistics, parents of autistic children, getting different perspectives because a lot of times in the autistic community, there's this almost negative observation of autism parents, you know, because of the whole idea of them talking over the autistic community and all this. And I really wanted to bring that perspective in, and so that not only autistics can better understand, but also non-autistics can understand what the parents of autistic children are going through and what individuals with schizophrenia are going through, so they're not people aren't afraid to approach them. Because I've found in my practice, schizophrenics are the sweetest people whenever they aren't under inactive psychosis, and like I said, that was the whole point of doing these roundtable discussions, to bring that more understanding to the world. And if it gets views, awesome. If it doesn't get views, hey, at least it's out there for people to see and to listen to in the future. So,
Absolutely. That's my logic with everything I post. It's that, because whenever I've come across a video on YouTube or TikTok or whatever, or content on Instagram that's about my experience, it's affirming and it helps me feel less alone, and it helps me feel like, okay, I'm not just this weird random, unicorn running around. There are other people who have my experience. So no, I really love that you're doing this. Thank you so much for inviting me to be on this. I am going to run away now, but it was really great to meet you both, and I would love to talk with you all again. And Ben, I
totally.
really hope that you watch Thunderbolts because I'd really love to hear your perspective, especially as somebody that focuses on substance abuse. I would really love to hear um, your thoughts on how it was portrayed.
Will do, will do. I'm gonna be rewatching Deadpool 2 tonight, I think, and get some good adamantium skull imagery in my head, and then we'll be working on that.
All right.
Awesome. All right,
Thank you
take care,
guys
guys.
for
All right,
joining
have a great
us.
night.
Yeah. Ben, did you have any final thoughts before we close the video?
Uh, I've really found something powerful that I think could be a whole nother conversation, and that is the parental behavior and maladaptive, adaptive, whether you your own view on it, given a child with any sort of disorder. And I'm really hearing these overlaps that I felt I see in the substance abuse community for these substance abusing kids and their parents, and how it's a general lack of information and it leads to issues, or it just completely 180s and they become that like central advocate. And I really don't feel like there's that middle ground. And I'd love to talk about that sometime and why
Absolutely.
that middle ground's so difficult to achieve, I guess.
Yeah, it's kind of goes back to what I was speaking about during our last CCS class after the presentation that was there, speaking about how oftentimes neurodivergence will run in families and older generations are forced to mask and parents re-traumatizing their neurodivergent children because they were forced to mask, and so they're now seeing things in their children that they learned to hate about themselves. um, I certainly know that was the case between me and my oldest child. um, there were a lot of characteristics of myself that I saw in my oldest. So I very much was a toxic parent to my oldest, who's now 22, um, and having that understanding of myself now, looking back at the way I parented before and how common that really probably is.
Yeah,
So.
exactly. Exactly. And it's unfortunate when you think about the amount of reflection that you just had to go through just now and how that never occurs in some parents who take this diagnosis that they're told by sometimes a complete stranger who barely knows their child, and they just say, "All right, I'll take everything you say," and just keep throwing it at the wall and see if it sticks. And or they can just dump their child in programs. And I feel like these are both very common overlaps of these two different communities, and how there's quite a variety of ways that the parents can reflect on how they behaved or how they quite frankly don't.
Mhm. So I think that does it for us today. It's been a great conversation, probably the longest conversation I've actually had on here, about an hour and a half. Usually I go about an hour, but we Eryk was a little bit late to the party, and I found it was a great conversation. We really didn't have to think too much about what we wanted to talk about, and I didn't have anything prepared of what to talk about. I just wanted to go off the cuff and see what everybody else wanted to talk about. And I think it went really well. How about you?
I agree. I agree. And I totally felt that the your your goal to be educational and to provoke thought was completely there. I didn't have things to say half the time because I was in this listening kind of like reflective mode. And I feel that a lot of people might get that same perspective. And I look forward to seeing how this does and if there's any follow-up conversations that draw from there.
Um, I would definitely like to have you and but Eryk both back. I've been inviting others back, like Stephania from our program as well. Um, and she was going to attend today, but she had a wedding she had to go to. Um, a few others that I've met on TikTok who are part of the autism and mental health community wanted to attend, but they had some last minute things come up. So I would definitely like to do more of these roundtables. And even if it's not just focused on one topic, having a variety of um, people with different experiences, whether it be, autism, ADHD, schizophrenia, substance use, whatever, come together and just have a conversation. I find that we're a lot more alike than we are different.
And that's the true wraparound treatment, I feel. That is the true wraparound the treatment is to have these different perspectives, have these different niches, and just kind of comparing, contrasting until you find that common middleman to move forward with. So I think you said that perfectly.
Well, thanks again for joining me today. Um, and I will get this edited over the next couple days and uploaded probably probably by Wednesday.
All right,
So,
that sounds great. I look forward to
all
looking
right.
for it.
Have a good week and enjoy your break.
You too. Have a good night. See ya.